So welcome. This is Interaction's launch of Aid Delivers 2021. We'll be starting in a few minutes, so bear with me as others join. And thank you for joining us. So again, welcome to Aid Delivers. We'll be starting in just a few minutes. We've got a good participant base coming in. Thank you very much for joining us this morning. Again, you're joining Aid Delivers 2021 launch. Thank you for joining us this morning. So good morning. Thank you for joining Interaction this morning to launch Aid Delivers 2021, Foreign Assistance in the 117th Congress. Those who don't know me, I'm Sam Worthington, the CEO of Interaction. We're excited to share this helpful resource and pull together expertise from across our broad community and to explore some of the more pressing foreign assistance issues out there. Before we get started, I just want to go over a little bit of housekeeping. Although this event is webinar style, we encourage you to connect and have a conversation using the chat function. If you have any questions or insights along the way, please drop them in the chat and we'll do our best to begin to address them during the panel conversation later in this event. As a reminder, this event is being recorded. Please mute your microphones when you're not speaking. For those of you that don't know Interaction, we're the largest alliance of US-based NGOs working on development humanitarian programs around the world. And it's now been over 35 years that Interaction has worked with its members to focus our expertise, to share best practices, to coordinate policy positions and outreach efforts. And we advocate with Congress and the administration and other policymakers to shape what we see as an effective foreign assistance. Many of you on this call know that foreign assistance works. And for information examples, please take a look at Interaction's latest report, Aid Deliver, and we're going to drop a link in the chat. We all know that humanitarian programs assist people affected by disasters, whether they're natural or by conflict. We know that long-term international development programs help communities end poverty. We've seen them advance human rights, promote resilient and democratic societies. I personally have seen the impact of these programs. When I was at Plan USA in Uganda, I witnessed the transformative power of ARV medication on HIV/AIDS patients. Much later on, I saw in Haiti when Catholic Relief Services delivered 3 months of food aid to save lives after that devastating earthquake, all funded by USAID. But foreign assistance goes beyond these sort of one-off programs or personal examples. They are a collective story that we all know. Since 1990, more than 1 billion people have been lifted out of extreme poverty. And the portion of people who are undernourished, who are in essence experiencing extreme hunger, has dropped by 50%. And for children, global under 5 mortality rates has dropped by 59%. These are impressive numbers that demonstrate what can be done when we work together, when we work as a global community, when we build the capacity of the world's poor and vulnerable. But foreign assistance is also crucial to US foreign policy priorities. And American investments in foreign assistance have yielded tremendous results. Over the past 17 years, and I was mentioning the PEPFAR program earlier, the US President's Emergency Program for AIDS Relief has saved over 18 million lives. We have built tremendous humanitarian capacity to save lives. In fiscal year 2019, USAID responded to some 66 disasters in 57 countries with some $6 billion of assistance. So as we know, advancing foreign assistance as a foreign policy priority can improve lives and livelihoods for people worldwide. It can support human rights, democracy, and good governance, and it does ensure a safer and more stable world for everyone. US leadership in world affairs has been critical to progress in human welfare, and we must continue this investment. And luckily, the American public agrees with us. The Chicago Council on Global Affairs polls have consistently found that Americans across party lines continue to endorse robust US involvement and leadership internationally. Nearly 7 in 10, that's 68%, maintain that the United States should take an active part in world affairs. And research at the University of Maryland done after the 2016 election showed that 2/3 of those polled say they favor that aid helps needy countries develop their economies. And we at Interaction, the broader Interaction community, and our members welcome this public support. Our members have grassroots efforts across the country. They come from every state, every faith, and nearly every community. Together, Interaction members mobilize some $15.4 billion annually to support their work, and much of it directly from the public. Support for US international development programs has a long bipartisan history. PEPFAR was created to tackle global HIV/AIDS pandemic during the Bush administration. And the passage of the Global Food Security Act in 2016 was set up to enhance Feed the Future in US global food. And in today's event, we'll hear more about recent passages of acts like the Global Fragility Act and the Global Child Thrive Act that were both enacted in the 116th Congress. And yet we have a lot of work ahead of us and lots of challenges. Inequitable growth, changing climate, rising levels of hunger and malnutrition, backsliding on democratic governance, increased conflict, displacement, all of these things threaten our world. And they're all exacerbated by the already complex landscape. And we're finding that COVID pandemic is eroding and even reversing many global gains that we've worked so hard to achieve. We have a lot of work ahead of us, and we must make these needed investments. As the 117th Congress begins, we must all remain committed to restoring and expanding the US role in protecting the world's most vulnerable. Today, we must investigate the opportunity ahead for the 117th Congress and the Biden-Harris administration to elevate our standing in the world, to tackle global development and take on humanitarian challenges. The Interaction community stands ready to work with Congress and the administration, and we want to chart a bold new course to shape a forward-leaning role in development humanitarian assistance within our broader US foreign policy. So now let's turn to a few congressional foreign policy leaders to offer some remarks on the importance of US foreign assistance programs and the issues that they'd like to focus on in Congress. First, you'll hear from newly elected chairman of the House Foreign Affairs Committee, Representative Gregory W. Meeks. Congressman Meeks is from New York and is now in his 12th term, and he's devoted his energy and his skills to serving what we see as one of the most diverse constituencies in the nation. And he is the newly elected chairman of the House Foreign Affairs Committee. He's the first Black member of Congress to serve as chair of that committee. Mr. Meeks, Congressman Meeks, is a multilateralist with decades of foreign policy experience. He believes that the United States should build coalitions around our interests to work with other countries to build a stable and more prosperous future. So Caitlin, if you could share the screen to play Congressman Meeks' video. Thank you very much.
Thank you. Hello, I'm Congressman Gregory Meeks, Chairman of the House Foreign Affairs Committee, and I'm grateful for the opportunity to speak today about the urgent need to restore humanitarian aid around the world and the opportunities before us under the new administration. Last week, I had the privilege to witness Joe Biden be sworn into office as the President of the United States, marking a tremendous shift for the United States and how it interfaces with the world. Congress, as a co-equal branch, will be working collectively with the administration to once again demonstrate global leadership, particularly regarding foreign assistance. and as chair of the House Committee on Foreign Affairs, I look forward to be a significant part of that process. Foreign assistance is a crucial component of our foreign policy and who we are as Americans. Responding to hurricanes in the Caribbean, providing food assistance in Yemen, or shelter to Syrian refugees. These actions are how we can be a force for good overseas and save human lives. And our development investments in health, education, and developing infrastructure, they help countries build capacity to support their people to lead healthy and productive lives, creating a greater prosperity around the world. Unfortunately, over the past 4 years, we've had an administration who sought to slash foreign assistance funding, sidelined our development professionals, and failed to engage our partners and allies who are essential to collectively tackling the development challenges we face. As chairman, one of my primary goals is to rebuild our State Department and to restore American diplomacy. That includes increasing diversity in our State Department and all of our organizations that interface with the larger world, so that our diplomatic corps and even our NGOs look more like the America they represent. But restoring America's image on the world stage also includes making sure that America is associated with a nation that offers a helping hand. Hopefully, in partnership with my ranking member, Mike McCaul, and other colleagues across the aisle, I'm determined to gain bipartisan support for our humanitarian and development assistance agenda. We face a global crisis in the COVID pandemic. We've seen more than 2 million deaths worldwide. Health systems have been overwhelmed. 1 billion children out of school, and a catastrophic economic toll. It is more crucial than ever that we make sure that the development gains the U.S. has helped make possible over the years aren't lost in this crisis. And that's why I'm strongly advocating for a robust foreign assistance component of the new COVID relief package. I'm also very pleased to see that the Biden administration will rejoin the WHO and join COVAX, the global facility headed by the WHO, Gavi, and CEPI for equitable vaccine development and distribution. We cannot be successful without bilateral and multilateral support for our medical workers, technical assistance for governments, for vaccine procurement, and infrastructure to get vaccines that last mile to populations, and sustained engagement to build the capacity of health systems. COVID is the most immediate challenge we face, and its ripple effects are still spreading. But it's not the only one, nor did it occur in a vacuum. The humanitarian needs around the world are massive, and we must respond both with immediate relief and sustained political engagement so that we can find lasting resolutions to their roots. In particular, we must support Venezuela's neighbors as they cope with a massive migration crisis caused by the reckless policies of Nicolas Maduro's regime. We also need to address the mounting food insecurity in the South Sudan, which is threatening to tip into a famine. In Yemen, we already see the single biggest humanitarian crisis in the world. The recent FTO designation of the Houthis is, in my view, short-sighted and counterproductive, threatening not just the critical humanitarian support, but also the invaluable commercial lifeline to the country. And I've urged this new administration to reverse that decision immediately. We also see places where the line between humanitarian and development needs blur. Fragile states are on the edge of collapse due to poor governance and insecurity. And climate change now threatens to undo development gains and create new needs. We must be proactive in identifying and preventing problems from becoming greater threats down the road. I champion human rights as an integral part of who we are as the United States of America. And as chairman, I look forward to speaking out against injustice on behalf of those who are marginalized and persecuted around the world, for those who seek to exercise their fundamental human rights, be it freedom to speak truth to power, or the right to love whom they choose, or have control over their own health. We must stand up for these human rights at home and abroad. The members of Interaction have worked tirelessly to serve the world's vulnerable, promoting a better, sustainable future. Your partnership in demonstrating the value of U.S. foreign assistance is invaluable, and I look forward to working with you as we move into this new Congress and the new Biden administration. Thank you.
So thank you. We've just heard Congressman Meeks give some very powerful remarks, very much aligned with our thinking as a community, our desire for greater U.S. re-engagement in the world, and using our foreign assistance as a key component of our foreign policy. It's interesting that he roots this in our American values, in a sense of both values linked with rights, as he identifies the sort of massive challenges that we face around the world, from COVID impacts to broader humanitarian realities. So now we're going to take a turn here, and we're going to turn it over to another Congressman Michael McCaul, who is now the lead Republican on the House Foreign Affairs Committee. Congressman McCaul is currently serving his 8th term, representing Texas's 10th district, and which stretches, I guess, all the way from the city of Austin to Houston. At the start of the 116th Congress, Congressman McCaul became the Republican leader in the Foreign Affairs Committee. In that capacity, he is committed to ensuring and promoting America's leadership on the global stage. And Caitlin will just turn over to play Congressman McCaul's video, please. Thank you.
I want to thank Interaction for having me here today to participate in such an important discussion about U.S. foreign assistance priorities. As a lead Republican on the Foreign Affairs Committee, I've seen firsthand how our assistance programs bring positive change and often life-saving supplies to people around the world. Unfortunately, the COVID-19 pandemic is now threatening to unravel much of our success. This year, a record 235 million people will need urgent humanitarian assistance. That's up 40% from last year, primarily because of COVID-19. And that's why we must begin to address the long-term impacts of COVID-19 now. This includes looking at how it's impacting election preparedness, education systems, food security, and the unique challenges of women and girls in developing countries. I will keep advocating for robust international assistance to address these priorities. Now more than ever, we need to work together and coordinate our efforts to ensure we use every dollar effectively. During the 116th Congress, we had many bipartisan priorities signed into law. The U.S. Northern Triangle Enhanced Engagement Act, the Branding Modernization Act, the Global Child Thrive Act, and so many others. I'm particularly proud of the successful enactment of the Global Fragility Act, thanks to the leadership of former Chairman Engel. I was encouraged to hear that Secretary Blinken has already discussed this law with President Biden and understands the policy tools it provides the new administration. By addressing root causes of instability and violent extremism, such as poverty and weak governance, this law will work to prevent conflicts before they occur. I'm also proud that key language from my Global Hope Act was included in the omnibus. Effective public partnerships will serve as another tool that we can use to fight childhood cancer around the world. These programs will seek to leverage existing global health investments and build on the successes of PEPFAR and other health interventions. I'm also so pleased to have another strong partner in Chairman Meeks for the new Congress. He understands the importance of vital programs like these, and I look forward to working together with him. Foreign aid is a key tool. We must maintain strong bipartisan consensus on why the work we do overseas matters so much here at home. Not only does it save lives and support our partners and allies, but it also pushes back on authoritarian regimes like the Chinese Communist Party, who offer a very different model of assistance. The United States must continue to show up and be a force for good around the world, and much of that starts with our humanitarian and development programs. So in closing, I want to thank our NGO partners. You're on the front lines each day, saving lives around the world in a true missionary manner. And it's been a pleasure working with so many of you, and I look forward to continuing our partnership in the 117th Congress. So thank you again for having me. May God bless the United States of America. Thank you.
So thank you. We have here again a very powerful statement about the bipartisan nature of foreign assistance, his desire, both in terms of achievements made by the previous Congress, his desire to continue to invest in and advance these important tool of U.S. foreign assistance, a recognition that the COVID vaccine has decimated so many countries, and that we face a time when we need to pull in and not pull back, to engage and not withdraw. And so we look forward to working with Congressman McCaul. And now I'm going to turn this webinar over to Noam Unger, who is Interactions Vice President for Global Development Advocacy and Learning, for a conversation with some Interaction partners and to further explore these issues in some greater depth. So over to you, Noam.
Well, thank you, Sam, for that great framing of the conversation, and also to Chairman Meeks and Ranking Member McCaul for their remarks. Both are great champions for U.S. foreign assistance, and we look forward to working with them as a community in the 117th Congress. Now, I get the pleasure of facilitating a bit of a deeper dive. First, we'll hear from NGO sector coalition leaders on the key issues they're tracking for the 117th Congress and how they've previously worked to build and support bipartisan action and legislation. And then we'll hear more from the U.S. Global Leadership Coalition on the political context for foreign assistance issues. As many of you know, the US-based development and humanitarian community has a lot of coalitions working to advance US foreign assistance, and each bringing their unique perspectives and expertise. But something that I've seen play out time and again since I've joined Interaction is that when it comes to advocating for foreign assistance and supporting vulnerable communities around the world, we're most successful when we coordinate and work together and learn from each other. And that's why we're going to turn to a conversation with several representatives from NGO coalitions actively working with Congress and the administration to improve US foreign assistance policy. So let me introduce our speakers, and if they could turn on their, or unmute themselves and turn on their cameras as I do so, that would be great. We have Loyce Pace. Loyce is a public health policy expert serving as the president and executive director of the Global Health Council, and was recently selected as a member of then President-elect Joe Biden's COVID-19 advisory board. Global Health Council members serve to raise awareness and catalyze action around important global health issues. Welcome, Loyce. And I also want to welcome Liz Hume. Liz is the vice president at the Alliance for Peacebuilding. She's a conflict expert and has more than 20 years of experience in senior leadership positions in bilateral and multilateral organizations and NGOs. The Alliance for Peacebuilding is a nonpartisan network of 130 plus organizations working in almost every country around the world to end violent conflict and sustain peace. Welcome, Liz. And I also, last but not least, want to welcome Leila Nimatallah. Leila's been advocating for poverty alleviation for over 20 years. Since 2015, she's been with Catholic Relief Services in their government relations office, leading on global health and Africa issues. She's here today as a co-chair of the Thrive Coalition. And the Thrive Coalition is a community of over 40 organizations and individuals dedicated to addressing U.S. government support for global early childhood development. So welcome to the three of you. We all got to hear the remarks from Sam and from Chairman Meeks and Ranking Member McCaul, but I'd be interested for the group that we have gathered listening in today to talk a bit about the context. You know, what's happening in the world, and what are the development and humanitarian issues ultimately that Congress has to address in the 117th. But first, let's talk about the big picture, what you see sort of happening and what are the priorities from your perspective. I'm gonna I'll pick on Loyce to begin. It's an important place to begin, as Sam noted, the decimation of the COVID virus and the pandemic. But then we can all just sort of jump in. Loyce?
Of course, I had a feeling you might pick on me first, Noam, so I'm somewhat ready for it. And I just wanna welcome everyone who's joined today. I obviously can't see you, but I'm glad to have you here and certainly appreciative of interaction for pulling us all together. As Noam said, we do consist of a number of coalitions who are sort of fighting the good fight. And I think as a testament to our work and solidarity, frankly, we truly believe in working towards these goals together. And I have to say how grateful I am to the broad international development community and our champions for really rallying behind global health. I think we all have known that global health has been an important piece of this puzzle for years. And certainly Global Health Council has been saying that. And yet, unfortunately, 2020 really brought all of that into focus. So I think, obviously, given the current context, we at Global Health Council really see that global health security needs to be and remain front and center. And I know that the Congressman talked about funding to address preparedness and response, and then beyond that, funding for sort of the ripple effects. But I would be remiss if I didn't talk about global health broadly as well. And so for us, it's also not just about global health security or preparedness or pandemics, even though that's critically important today and always. Global health is a range of things, right? It's a spectrum of priorities. And frankly, we can't forget about sort of all of the issues to which we're connected across development. So we'll get into that a little bit later, how I see those connections working. But please believe me when I say, you know, I'm not going to be the one here saying, okay, now we have to talk about health and nothing else, right? Because we know that, you know, while health really drives developments, broadly speaking, there's a really important interplay that we have to keep in mind when it comes to our policies and investments. So I'll stop there, but that's
that's great, Loyce. Leila, maybe I can draw you in on this from your perspective in terms of the context in the world.
Sure, thanks so much, Noam, and thanks to all of you for inviting us. We really appreciate it. Maybe I'll just begin by acknowledging Congress, because they are the ones, you know, it was referenced earlier by Sam, they're the ones that led globally in terms of ending preventable child deaths over the past 30 years, the child survival revolution. And for us in the Thrive Coalition, they have enacted this new law, the Global Child Thrive Act. So we're super excited about that they're leading again in the area.
Yeah, Congressman McCaul mentioned it even in his remarks. Yep.
He did. And we are just so grateful to them. So for us, I guess the first piece would be, we're hoping that they'll follow up and ensure successful implementation of that law. And then by perhaps really looking at foreign assistance so that it can be most impactful. And to do this, we've, within the Thrive Coalition, have always said it's important to continue to build upon the science of brain development, because we know that 80% of human brain growth occurs by the age of 3, and 90% of it is complete by the age of 5. And if children don't receive the nurturing care during these very critical early years, they will grow up with stunted brains, they'll live shorter, unhealthier lives, they'll earn 25% less than their peers. And unfortunately, there are estimated to be 250 million children worldwide growing up with stunted brains, and that was before COVID. The good news is that we know that there are cheap, very simple interventions like teaching parents to play and sing and read to their little ones even before they can speak. And this can change the trajectory of a child and her family and our country. It's what the Global Child Thrive Law does by directing that early childhood development be integrated across all sectors and treating children as holistic human beings, which is best policy. And just a quick aside, early childhood development, for those who have not heard the term, it refers to a child's physical, cognitive, and emotional development from prenatal months to age 8. And so now that Congress has enacted the law, we are hoping that they can again turn to the ever-present funding piece. And Congress can look at the fact that we're spending very little in terms of those early brain building years. And it's not to say that we want to, excuse me, take away funding, excuse me, from anything else, not at all. But we know that there, anecdotally, that few children are receiving this full package of early childhood development that they need. For example, we know like little pieces of the picture, like for example, 3% of US foreign assistance overseas development in crisis situations is going to these very early years. So if we can look at that funding piece and oversee the Global Child Thrive Law, that would be fabulous.
Thanks, Leila. I'm glad you raised the sort of the whole child approach and the early years, especially. You know, there are many different factors that affect the development of humans, especially in those early years. And one that's really important that we all watch along with others is malnutrition. And, you know, after nearly a decade of decline, global hunger levels have been on the rise since 2015 due to persistent challenges of conflict and climate change. There's now an estimated 270 million people could be acutely food insecure. And you know, also this is sort of part of a broader set of humanitarian concerns. 235 million people are in need of humanitarian assistance at present. And that includes 80 million people who've been forcibly displaced. That's 1% of the global population. And it speaks directly to issues of conflict. And so Liz, let me turn to you because I know you've been steeped in this perspective of conflict and its interplay with broader development and humanitarian assistance. What's your take on sort of the broader context and what we should all be focused on?
Thank you. Thank you for inviting me today. And I just really also want to pick up on one of the things that Leila talked about is how important Congress has been, especially over the last 4 years. They have really stayed true and been a bipartisan champions on these issues. So we are really grateful. And that also talks to the Global Fragility Act, which was a bipartisan act, and Ranking Member McCaul was one of the lead co-sponsors in the House with former Chairman Ingle. So we are grateful for Congress and what they did over the last 4 years. We look at it holistically. And looking at the Global Fragility Act, what was the problem we were trying to solve? And we'll get to that a little later, but in talking about the overall issues, violent conflict is one of the most significant issues for foreign policy. It has triggered some of the worst displacement and refugee crisis, as you talked about. It drives extremism. We know in countries that are experiencing violent conflict, that's where you see, over 90% of terrorist acts. We know that since 2010, major conflicts have tripled. And in 2019, we witnessed over 196 violent conflicts and 38 full-scale and limited wars. So this is huge. We know climate is a threat multiplier to conflict-affected and fragile states. COVID has a destabilizing impact. It's a health crisis, but it also isn't just a health crisis. That we can see this even in the United States. And there are recent studies that show that COVID will be driving additional conflicts into 2022. So these are all the symptoms of violent conflict. So what we do is we take a look at it and say, what's driving it? So, we go where those conflict issues are. A lot of times they're rights-based, human rights, governance, weak governance. There's so many contributing factors to conflict, violent conflict. It's complex. But we are getting better at understanding, knowing what drives it, but also how we can prevent it. And with the Global Fragility Act and other tools like the Women, Peace and Security Act, we are developing better tools for the US government and working with multilaterals and other donors and other foundations, implementing partners. So not only do we have to be looking at the drivers of conflict, violent conflict, and the symptoms, but also how do we prevent it and how do we get better at it? And that's what the Global Fragility Act tries to get at.
Yeah, thanks, Liz. And you mentioned the sort of contributing factors and the interplay. I'm interested particularly in the mention of climate change. Simply because now with the change in administration and the priority being placed on climate change, it's going to be a big issue for the next Congress as well. Climate change threatens our ability to ensure global food security, to eradicate poverty, to achieve sustainable development. The people with the fewest resources and power globally are disproportionately bearing the burden of this crisis. And so if left unsupported, they'll continue to do so. And it's everything from shifting weather patterns to rising sea levels, more extreme weather events. And it does play into global health and the success of early childhood development and, conflict. But I guess the question going forward as the Congress kicks off is, so what is the role? I mean, you Leila and Liz, you alluded to legislation that has passed, and Loyce, I know there's been, these some stimulus or supplemental sort of funding embedded at times with stimulus around COVID, but it's a global pandemic. So what are we looking for in the coming Congress? What do we think they can do, either in terms of legislation or oversight? What's their role?
Yeah, a few things, right? The funding is still, we'll keep coming back to that because that's still incredibly important. And obviously we've been grateful for the investments made over time, including last year, particularly the $4 billion that went towards Gavi and vaccine distribution. But we as a community were asking for at least 20 billion because we were able to speak and work with our partners on the ground to really understand what they were facing as a result of the pandemic. And again, these ripple effects, how they're affecting things like childhood immunization or even sort of BetNet distribution for malaria control and other such initiatives. And so that price tag we know sounds high, but we are worried.
Well, but it's you're talking about out of $1 trillion plus packages, right?
Exactly. And again, out of billions invested over time towards the progress of these goals, right? So do we want to continue to sustain that progress, or do we run the risk of sort of backsliding? And I think the latter we just continue to see is true. And these aren't just NGOs asking for this, right? Global Health Council at least includes corporate members who are steadily working towards the response, really sort of coming up with innovations and trying to do their part and make their investments as well. But we absolutely need government, and particularly the US government, to step in as well. But I also want to highlight, others have highlighted pieces of legislation in previous sessions. We at Global Health Council, working with our Global Health Security Roundtable, worked closely to help develop and endorse a bill co-sponsored by Representatives Connolly and Chabot that's been reintroduced in this session. So that's a very concrete opportunity for champions to support global health security in particular. It's the Global Health Security Act, and there's an opportunity to codify what's been put forth in previous administrations. What we want to see or hope to see is not just global health or global health security specifically supported by executive action and sort of tossed back and forth, but really embedded as legislation. Beyond that, though, I would really like to see and have more conversations about health systems. That hasn't always been popular. It's been of interest to some offices, but I think it's been very hard.
What does that mean, though?
Yeah, well,
Maybe
so
why
that's been the issue, right? So people are like, what is it? It sounds too loosey-goosey. We like babies in buildings, you know, we like to be able to sort of touch and feel where we're investing. But I think what COVID has really shown us is what we as public health people have known all the time, which is it's not always an easy answer, right? There are pillars of health systems that groups like institutions like WHO have acknowledged, so healthcare workforce, data and surveillance, financing, procurement. So they're very clear kind of results that we could track to understand where a health system is. But we need those investments, those sort of cross-cutting investments, just as much as we need investments in these silos. And so I would hope that moving forward, we can have those conversations and really develop those policies and even that funding for the fundamentals of health, right? It doesn't mean we take away from HIV or Ebola or other issues. And yet each of those priorities requires a base. You know, it's like when you're building a house, you have the pillars, you have the, you know, the bricks and mortar, but you need that foundation. And we frankly don't have that as well as we need to be in place right now.
Thanks, Loyce. You know, the mention of COVID makes me want to circle back, Leila, to what you were talking about in terms of what you're seeing in terms of early childhood development. What are you seeing from the ground perspective in terms of the impacts just even over the last year?
Yeah, thanks for asking, Noam. Well, you know, even before COVID, children were a third of the global population and a half of the extreme poor. So it was already not a very good situation. But what we're seeing on the ground is concerning. It is causing extreme stressors on families in terms of lockdowns and the loss of economic support. And what we've seen is that the secondary impacts of the pandemic fall the hardest on vulnerable children in terms of malnutrition, loss of education, and violence. And we've done a few studies on the ground with partners in Uganda. Unfortunately, we have seen an 800% increase in violence against children, including sexual violence. In Kenya, we did a study of mothers in a mothers and babies course that we are implementing. Mothers came back, 82% of them came back saying that COVID has had a negative impact on their mental health. And 54% of them said it had a negative impact on their children's mental health. We're also seeing an extremely high rate of caregiver death. And the loss of a caregiver for a child, especially a vulnerable child, like a child with a disability, for example, makes it so that there's a high risk of family separation and institutionalization for that child. So there's a lot of things we're seeing that are very concerning and will require some innovative adaptation on all our parts.
Yeah, thank you. I guess I want to come back to this, the question of Congress and, you know, how it really works, right? I mean, we've talked about the legislation that even in this last period of time, which was very tumultuous for all the reasons we all know, this community and in a bipartisan fashion, we were able to work with members of Congress across the aisle and get legislation across. But for somebody who doesn't really understand how that works, like anyone want to offer like what it takes to sort of build that up and what it's going to take to sort of continue to sort of maintain the support and the constituency and the coalition? Liz, you want to jump in?
Sure. I mean, it's incredible that we were able to move some of these bipartisan acts, and the Global Fragility Act, I think, is a great example of that. We built a coalition, Mercy Corps and the Alliance for Peacebuilding co-lead the GFA coalition. We have over 65 members. And we started off, I mean, this is going back into 2015, asking ourselves, you know, what is the problem we're trying to solve? Everybody talks about conflict prevention. Everybody talks about getting to the root of the issues, but there's so many crises that are going on at any one time. You know, it's hard to focus. So we wanted also, originally we wanted Congress to take a look at violence, reducing violence, and look at it as almost like a PEPFAR, or a malaria or something like that. Food security, and looking at it as just as important as those issues, because we know conflict wipes out development gains, it destroys lives. Countries get stuck in a conflict trap. So within 10 years, you're more likely to go back to conflict. So we know all of this, but yet we don't really focus on the prevention piece of it. And just like Loyce was talking about, is the integrated programs. So we're not saying don't do HIV or stop doing education programs or stop doing support to peace process programs. But one of the big key parts of the Global Fragility Act is that it wants the US government to take a look at its diplomacy and foreign assistance and say, what is our overarching strategy here? And that is what the Obama-Biden administration was doing in the Northern Triangle the 2 years before the end of that administration. They had an overarching strategy. And how they also were leveraging other bilaterals, multilaterals, and then saying, we need to measure this. We need to see if what we're doing is actually reducing violence. Is it preventing or stopping migration? Because people want to stay where they live. So it's also a way for Congress to hold the funding that they're pushing out accountable. And so those are really two key pieces of the Global Fragility Act: getting at the prevention, making sure that it's multi-sectoral, and we're all working together. And we know that because in Somalia, we can see that an education program that is also has civic components to it, we can see that it reduced violent extremism. But if we stay in our silos and we don't want to take that approach, it continues to be the same. So in countries, you'll see health sector and education indicators go up, but you're also seeing conflict and violence going up because we're not addressing the governance and the systems that Loyce was talking about. And we're still looking at that immediate crisis.
So two things, because what you're talking about with the sort of integrating across silos and breaking down silos and Congress's role in that relates to a question that's come through to me from the chat from Mark Engman from UNICEF USA about how to really go about doing that. But now I want to come back to you, Liz, for a second, briefly, like, what's Congress's role now that GFA has passed in this next Congress? What should they be doing in relation to this? If you're sitting in Congress, what are you thinking?
An incredible role, and really it's about oversight, because now the U.S. government has drafted a strategy that went out December 19th. The next is a timeline for country strategies to say, well, first to pick the country regions, and it's a pilot initiative, so there's 5. So they have to make sure that those timelines are going and that they are actually implementing the law. And at the same time, again, going back to what Loyce said, is you have to fund it. Right now, originally it had been funded at $200 million. In the last appropriations, it was about $100 million. So, it's also not fair to throw an unfunded mandate on state and aid and others that are already, overtaxed with COVID and other issues.
Yeah. Loyce, you talked earlier also about sort of breaking down these silos and working across. Speak more about that from your perspective, especially, everything that you've been working on over the last couple of years.
Yeah, I have a lot of thoughts on this, as you know, and I guess I would even tie it back to your question of how Congress comes together. So we talked about PEPFAR and how I think that's been viewed as a great unifier, at least in the global health space. And when that was sort of introduced, you had faith leaders alongside LGBTQ advocates, for example, and sort of everyone in between. And as political and controversial and even divisive as this pandemic has become, I really see a lot of opportunities there to connect dots, to really bring us together in different ways, whether you are coming at this from an equity angle and ensuring that we reduce disparities in this country and abroad, or, distribute vaccines equitably, or an economic angle, right? Really looking at what it's doing to sort of individual pocketbooks and, sort of the global economy. So there are a lot of opportunities there to build those bridges and connect dots in ways that I just want to talk more about, especially given how political it's become. I think other, obvious silos to potentially break down is sort of this us versus them, right? Like, I think Liz or someone else was really speaking to how this issue has affected us here at home in ways that, global health has never really felt so personal to a lot of people. I mean, I know as a Black woman that maternal mortality is quite high in this country, as are HIV rates among BIPOC communities, but not everyone in this country has truly been faced with a global health priority and crisis, frankly, as we've been dealing with the past.
We're all talking to each other in little boxes on a screen right now.
There it is, right? And you have Bill and Melinda Gates coming out with their letter this week saying the exact same thing. Like, wow, now people get it. It's now everyone knows who WHO is and understands these priorities. And so I think we should use that to our advantage too, right? Again, this has been a crisis, and yet what is a crisis if not an opportunity for real change? And so I really implore Congress and everyone on the Hill to think about it in that regard, right? And to really, see this as an opportunity to help your constituents understand what we're all talking about. I don't think you have to make, or I think there's an opportunity to make a different kind of case to our stakeholders, and that includes all of us, right? So that we can really get ahead of this, so that we can truly make these investments, again, that are a drop in the bucket in the whole scheme of things, but that we know, sort of, I talk about paying now or paying later, and there's a real cost of inaction if we wait, right? And if we think, maybe it's not the right time, maybe we can't really sell this. I really think we can do more. And I think we can give people in this country a lot more credit than maybe we have in understanding the urgency of this and even sort of finding that common ground.
Yeah, I mean, one of the things that we're so used to doing is thinking, and in Congress too, and in that State Department or AID where I've worked, like in terms of like accounts and silos. I mean, Interaction annually comes out, you all know, with our community recommendations around, informed by needs in the world around funding levels. And we do it across, now 50 different accounts. And yet we're trying to convey the integrated nature of these things and the interplay between them. It goes, Leila, it's like what you were talking about, or probably the reason that Mark Engman from UNICEF USA raised the question in the chat is because, the idea of this whole child approach that you referenced is this integrated approach. We ourselves have started a children and youth initiative to try to sort of thread these pieces together and say how these different programs and tools in the toolbox can work together to do what we know is just good development.
Yeah.
Leila, I don't know if you want to sort of speak to that a little bit.
Sure, thanks, Noam. Yeah, I can see what we did at the Thrive Coalition. Well, first of all, yeah, we came together. We followed the science, we followed the experts. There's a Nobel Prize winning economist who had given us the statistics that if you invest in the early years, you get a 13% return on investment every year, benefits to society. We followed other experts like Joan Lombardi, and a number of us had programming on the ground that we were implementing and integrating across early childhood development across sectors. And we brought that on the ground experience. We also tried, as Liz and Loyce have said, to work hand in glove with each other. There was there's about 40 of us in the coalition, but there's a handful of us who worked really, really closely, each of us bringing our own expertise, like UNICEF USA, the American Academy of Pediatrics, PATH, SPOON, IRC, the LEGO Foundation, Basic Education Coalition, Child Fund, World Vision, and each of us brought something to the table. And we also agree that it's really important that we raise together all the programming that supports vulnerable children. basic education, maternal and child health, nutrition, and all the rest of it. So every year we included all those asks in our annual appropriations work. We used report language requests to try to, raise awareness about the issue that we cared about, but meanwhile raising all boats. We created grassroots around the country and tried to educate them about the importance of this sort of integrated, holistic approach for the whole child. And they supported their members of Congress. And then we tried to build bipartisan support within Congress. And most importantly, our House and Senate leads were just fabulous. Senators Blunt Coons and Representatives Castro and Fitzpatrick and their staff. They were really savvy and they were willing to put their political capital on the line to get the bill over the finish line. And we had, former Chairman Engel and Ranking Member McCaul, who always, they're known as the most bipartisan committee, and they always put the issue first, and they were so committed. So that was why we were successful, and it couldn't have happened. Our success could not have happened without their leadership. And so maybe I'll just end by saying, if anyone wants to join us, you're all welcome, because the more the merrier. Please contact me if you want to join the Thrive Coalition.
And I think where that point that you spoke to about the bipartisanship, including of the House Foreign Affairs Committee, was demonstrated at the beginning of this webinar, just in the comments, and the comments about each other from Meeks and McCaul. And it's nice to see. It's reassuring to see. I think they have their eye on the ball, and we all need to sort of help them sort of form this integrated approach. And I'm really grateful for Zoom, because you're allowed to have conversations at multiple levels. And a great question came in from Whitney Groves from World Vision, and Loyce was able to start to address it, which is also just about the critical ways that we and all of our organizations think about partnering with those at the local level closest to the issues. In many cases across our organizations, the staff of NGOs are locals on the ground working on these issues, and programming is informed in that way, working with other organizations and other civil society organizations on the ground. We're at time for this part of the conversation, and I just really want to thank you, Loyce, Liz, Leila, for joining in this event and this conversation. And I'd like to ask everyone else to please thank them, and you can thank them in the chat, or flag your favorite point, and we're going to continue the conversation. As we say goodbye to Loyce, Liz, and Leila, and they go off screen, we're going to bring Jason Gross from USGLC on screen. Before I sort of get started in back and forth with you, Jason, just want to sort of introduce you to folks. For anyone who doesn't know, and actually probably many people on this call do know you, Jason serves as Executive Director of the U.S. Global Leadership Coalition, tapping over 20 years of public policy, Capitol Hill, and presidential campaign experience to oversee day-to-day operations of the nationwide coalition. USGLC brings together more than 500 businesses and nonprofits from across the country to strengthen America's civilian-led tools, development, and diplomacy alongside defense. By advocating for a strong international affairs budget, USGLC is working to make America's international affairs program a keystone of US foreign policy. Jason's really one of the best people to help us understand the political context for foreign assistance in the 117th Congress. And part of that is because of this effort that I know USGLC, you and your colleagues have been leading, called Impact 2020, or the Impact 2020 initiative, really engaging candidates and their campaigns even before they get to Congress. So maybe I'd like to start there, Jason, if you could tell us a little bit about that effort, and also then what you've learned from it.
Thank you, Noam, and thank you for inviting me to join today, and also for the partnership with Interaction and your member organizations in our advocacy and education around the country, which we'll be discussing more today. Just taking a big look back, as we were enlarging our work around the country over the last decade with members of Congress, it became more apparent that we needed to work with congressional candidates before they reached office. And the idea here was to build trusted relationships with the type of kitchen cabinet drawn from NGO, business, faith, and veteran leaders in our state advisory committees in our 32 states. First of all, to head off problematic positions that members we have to walk back from if they made in the campaign trail when they reached office. for some members. For other members, I think it was to try and build greater momentum for future leadership. So when they reached Congress, they had a trusted group they could rely on, and they can make a running start more to lead on these issues that we'd want them if we engage with them on the trail. So from day one, we wanted to establish constituent leader support for development and diplomacy for members of Congress. So this cycle, our meetings began back in August of 2018, and beginning early allowed us to meet with more candidates. We met with actually over 300 candidates for Congress, Republicans and Democrats, this election cycle to begin to develop those relationships. And as we saw, the 2020 election cycle really became dominated by the global pandemic. Prior to March of last year, it was definitely the economy in China were the primary interest of candidates we were engaging with. After March, it was completely COVID, no matter which political party. Yeah. Early in the cycle, there was definitely interest in understanding the disease and how to, the virus and how to defeat the pandemic, the recognition, I think, of the global connection to the local nexus that we emphasized. But as the pandemic worsened domestically, the focus just so retreated back into addressing it at home, understandably. Polling showing that 80% of voters concerned about the domestic impact of COVID. And by the end, only 10% of all TV ads for candidates had any foreign policy theme. So we saw this really reflection inward as the crisis grew. And I think we had a challenge for that dialogue to continue on the international nexus of it.
Which is ironic a little bit, right? It's understandable. I think we've all seen it, that sort of inward focus on the crisis, even though the crisis itself is a global crisis and caused by sort of cross-border issues and all that kind of stuff.
And and I think among us optimistically hoping it would make that connection organically and automatically and make it, but the scale of it domestically didn't allow for it. And there's a theme we'll get back to, I think, about what we need to do going forward to make sure that through this crisis domestically, we can penetrate. And then it also set in very partisan camps. Republicans wanting to say it was being handled well, Democrats the opposite, running in opposition, 9 out of 10 voters feeling their party would handle the pandemic better. The candidates reflected a very divided country. Republican candidates like Senator Tuberville in Alabama, Representative Cawthorn in North Carolina, who took Mark Meadows' seat, very much embracing a President Trump framework. Broadly, I think people were open to global leadership role in defeating COVID, certainly in countering China, giving their role in delivering PPE and vaccine diplomacy for Republican candidates. In the House, I would say, for most non-incumbents running for House, not a great deal of familiarity with foreign policy issues. We're definitely ramping up their understanding. But that said, we'll talk about more. There were actually 5 USGLC Advisory Committee members who were elected to Congress. And that's a running start for us there.
Yeah, and I think it's interesting to think about some of the stats that you cited in terms of where Sam started at the beginning of the conversation, which is like those Chicago Council poll numbers of the American people, and like solidly like 70% feel like the U.S. should play like a really active role, engaged globally on the issues that USGLC and Interaction and others all sort of focus on. So let's think about the new Congress then. So what are those members thinking about foreign assistance specifically now? Like how large does it loom or interplay into sort of their priorities and thinking?
Yeah, let me start with thinking about some of the 5 members of USGLC state advisory committees who ended up being elected to Congress. So these were folks who were engaging with us with future candidates, and now actually this cycle won to Congress. So think about.
Wow. Okay, so there are people who've been part of the movement that you've built, and that now they're sitting in Congress.
Now taking it to Congress directly. So starting with Representative Jacob LaTurner from Kansas's 2nd District, formerly worked for Lynn Jenkins, who's our state AC co-chair in Kansas. A really strong understanding that he built on PEPFAR and food security and food assistance. So coming in with a running start there with strong ties to WFP US as well, I know from their conversations. Deborah Ross from the 2nd District of North Carolina has attended our annual summit, was a leader in our engagement on development diplomacy in Congress with candidates coming. Marilyn Strickland from Washington State, the 10th District, South Korea-born businesswoman, former mayor of Tacoma, will be a strong voice in the Progressive Caucus. as mayor of Tacoma, she established the city's first commission on international relations. Stephanie Bice, Republican from Oklahoma's 5th District, first Iranian American elected to Congress. She has always emphasized the bipartisan support for international affairs budget and exports as being key to growing Oklahoma's economy in the future. And our 5th was Carlos Jimenez, Cuban from Florida, Republican, Cuban-born American firefighter, a long-term member of our USGLC State Advisory Committee, served as the mayor of Miami-Dade County. His global perspective shaped by his constituents. Nearly 50% of his constituents born abroad, 2/3 speaking a language other than English at home, more than double the average rate of congressional districts even in the state of Florida. So you have this baseline of these key members coming into Congress. I think we'll have it top of mind right now, and ones where, as we saw the dynamic last year of Congress and the influencing Speaker Pelosi's decisions on international assistance, how key these new members will be in a tightly divided Congress right now. On the Senate side, you have Bill Hagerty, senator from Tennessee, who was a former ambassador to Japan. Ben Ray Lujan, New Mexico, a strong champion on a range of issues that Interaction Coalition has supported. John Hickenlooper of Colorado, the first of the presidential candidates to give a foreign policy address, engaged with our presidential outreach that we did of candidates in Iowa and South Carolina. John Ossoff, an LSE grad, aide to Hank Johnson in Georgia, filmmaker on issues in developing countries. Mark Kelly of Arizona, strong national security, veteran NASA presence, great dialogue with our leaders there. And Roger Marshall in Kansas has been doing a number of events coming from his district in the House on food security, another one I think to really engage on food security and ag issues.
That sounds great. I mean, it's actually very heartening to hear you sort of tick off these leaders and the sort of specific influences that are shaping their perspective that lead them to sort of support or be potential champions for the issues that we know are important, critically important to the world and to vulnerable people and to American interests.
Two State Department alums know I'm coming in, Blake Moore from Utah, Sarah Jacobs from California. She's already been appointed to House Foreign Affairs Committee. So even more of the practitioners coming in to join Tom Malinowski and other ones, who have entered the ranks over the last Congress.
So these are all folks who can help put their shoulder to the wheel. What about some like real world headwinds? I mean, we did just come off of sort of an administration that was trying to slash budgets to foreign assistance, didn't sort of appreciate the role that it plays in the toolbox of American engagement globally. What are your thoughts on sort of some of the obstacles or challenges?
That was a huge obstacle, but Congress fought back, as we know, and we had 4 years of restoration fully, including fully funding of the base bill of 21. But look, the narrow margins of control, 20 years, the narrowest Congress now, 50-50 in the Senate, 222 to 211 in the House, more heightened partisanship with more control on the balance, makes it harder for us building this bipartisan consensus right now for foreign affairs spending. New leaders in key committees right now, Rosa DeLauro on House Appropriations, Bernie Sanders about to take over on Democratic for the Budget Committee. These are supporters and understanding of our issues, but they're first domestic champions. So the question there, I think, is who's going to fill that leadership role of Nimatallah, who played so importantly at the head of House Appropriations and on the SFOPS subcommittee. We saw Republican leaders willing to push back against President Trump over the last 4 years, leaders like Lindsey Graham, Mike McCaul, we heard from earlier, of course. They were willing to push back and restore money before. Will they be able to support a President Biden if he is going to go forward with asking for increases? Still remains to be seen, and a challenge for our community to buttress that support too. And I think overall, as we saw as an emblematic at the end of the year, as Loyce referred to earlier, we got that finally $4 billion breakthrough on Gavi, Vaccine Alliance funding at the end of the year spending bill. But that was an enormous challenge by this community, pushing for 9 months, leadership from Lowy and Pelosi to make it happen. And yet we were only able to get $4 billion of $20 billion.
It's just the start. It's just the start, in fact, of really beginning to address this pandemic globally, because unless we beat it everywhere, we're not going to defeat it. So So you guys have a lot of experience in messaging politically, both, you know, not just here in Washington, but across the country. But in either or both, whichever you think makes sense to speak to, what messages, I guess, have worked, and what do you think is most likely to work now in the next political period?
I think, as has been clear today, it's got to still be embracing the dominant political framework of COVID right now. For the direct implementers in your coalition who are seeing the impacts right now, of how important that is to continue to testify about how this is affecting us, to building lasting global health infrastructure that Loyce has been talking about for years, how it's disrupting longstanding education, health, economic development, food security programs for your other practitioners. The COVID variants, I think, right now really do make that national security argument that Liz Hume was talking about earlier. Maybe it was hard to say this is going to rebound to our shores when it was already here last year. Now the variants show that if we can't address it through vaccine and stopping this abroad, it's coming back with more intensity and undermining our national security here too. The economic argument is so important as well. Our cost of inaction we've been talking about for U.S. exports from the business community being affected to Latin America, Asia, Africa. If we don't control this right, if we still don't get a hold of this right now, our ability to grow out of this recession is going to be stunted and stopped. We have to be able to do it for our economic interest as well. And I'd throw in, and that kind of goes into, I know we're running low on time right now, is where the incoming Biden administration has been talking about, as for a number of people we work with over the years, the foreign policy for the middle class. This idea of connecting the local to global is so much more important than ever right now, with the focus on the domestic pandemic, getting out of this recession. It's incumbent upon all of us. It didn't work automatically last year. We made some progress in connecting the biggest global health crisis in a century, of how it affects us day to day, competing with domestic imperatives. We've got to hone that in and sharpen it even more to make the case in order to get Congress and the administration to make the push through on the resources we know are critical to moving forward.
And I would think and hope that in the current moment, and we got into this a little bit in the last conversation, that it's not even, that the frame of COVID is not even the frame of COVID response, but also the perhaps a shift in mentality that people have had on the importance of prevention, right? That like, okay, this one's COVID, the next one might have a different name, but the whole point is we actually have to engage in that preventative investment, and people are more likely to be receptive to that because of what everybody has experienced over the past year because of this pandemic. Does that resonate?
Absolutely, of getting ahead of it right now, and that's directly in global health infrastructure, but it's back to Liz Hume's points about fragility and resilience too, and it's all of the programs that the Interaction members implement around the world to create greater resilience that that feed into education, food security, economic development, that governance, democracy, and governance as well for freer societies that are able to build more resilience to the next pandemic, so that its effects are not so severe back here at home as well. And that is about us being on our front feet and investing in the tools, in the development of diplomacy tools that we need to prevent the scale of the next pandemic coming down the road too. That's our window of opportunity to define that, I think, with Congress and this incoming administration.
Well, thanks, Jason. We are at time, but it's fascinating to hear all this from you, and I really appreciate you joining us for this online launch of our Aid Delivers work, which is really meant to educate our partners across offices in Congress and around the community. Thank you so much. I'd ask again, those of you listening in to sort of jump into the chat and voice your appreciation for Jason as well. And with that, I will turn off my own camera and turn it back over to Sam. Thanks, Jason.
Thank you, Noam. Thank you, Sam.
So thank you both, and I hope you all find this conversation as helpful and motivating as I did. A real huge thank out to our speakers, Loyce, Liz, Leila, Jason, and Noam. Really appreciate this conversation. The Interaction community will be virtually on the Hill next week, targeting freshmen and sophomores in the office with foreign assistance matters that matter most. We have a lot to work to do with Congress. I'm excited that we're getting started. So thank you for joining us. Thank you for looking at Aid Delivers. Keep up the pressure to elevate U.S. foreign assistance. And above all, please do stay safe and have a good morning. Thank you all.